Hi guys, welcome back to another video. Now, many of y'all who are viewing my channel obviously come from healthcare professional backgrounds, and in today's video we will be discussing a very important update about the health and care worker visa. And for those of y'all who do not know about this, please do not forget to check out this video where I've explained everything about it and why I keep recommending this visa, not only on my channel but to everybody who follows me on Instagram as well. And if you haven't followed me already, my handle is physiotherapy in UK. So do follow me on Instagram for latest updates, because I put out daily information on Instagram, not only about visas, but generally life in the UK and things that you can do to land a job more effectively. But diving right into today's content, let's just see what is the major update about the health and care worker visa. But even beyond that, why the UK government might actually stop recruiting healthcare professionals from some countries from now on. So let's get right to it. So, right, coming down to the first important thing, just for those of y'all who do not know about this, the UK, whenever it aims to recruit healthcare professionals, follows something known as red list countries. Now, for those of y'all who do not know what is red list countries, stay tuned because I will be explaining all of this in very clear detail in the next few minutes. But as of the 14th of March 2023, the WHO, that is the World Health Organization, has updated the red list of countries generally across the world. So as you can see right here, this is the update that was shared by the WHO. Now, as you can see, this update was actually named a document called the WHO Health Workforce Support and Safeguarding List for 2023. So this document basically lists down all of the legal requirements that countries such as US, Canada, UK need to follow, especially while recruiting healthcare professionals from countries, especially from Southeast Asia and Asian backgrounds generally. So just talking a little bit more about this report, what the WHO essentially does every year-on-year basis is it identifies how many healthcare professionals are there for every country, and on the basis of that it classifies the countries into red, amber and green. So countries that are on the red list typically have very less healthcare professionals within them, and therefore it would urge, or it would sort of place a demand on countries such as US, Canada and the UK to not recruit as actively from these countries, because they already are in a deficit stage for healthcare professionals within these countries. As you can see right there, whenever a country is listed on the red list country, it says that no active recruitment is permitted. And according to the WHO's website, all of these countries are listed down in Annex A. Now, I will leave the link for this in the description box below. So if you have further questions, or if you are not from the countries that I'm discussing in this video right now, please head over into the description box, find that link and check if your country is on the red list countries at the minute or not. But as you can see, just in terms of this report, what it says is if the workforce index is below 55 healthcare workforce density, below the global median of 49 medical doctors, nursing and midwifery personnel per 10,000 people. So what essentially it says is for every 10,000 people in the population of a country, if the workforce of healthcare professionals, and it's not only limited to doctors but all of the healthcare professionals, is less than 49, then you would essentially be listed in the red category or in the red list category of countries according to the WHO. Now, the reason for them to list them down in the red list countries is because these countries require priority support for health workforce development and health system strengthening, along with additional safeguards that limit active international recruitment. So the reason basically the WHO has identified is obviously because these countries already have lesser healthcare professionals. If there is active recruitment into other countries for this country, say for example India, if there are more professionals from India moving on to the UK or to the US or to the Canada, there are going to be even lesser doctors in India to treat the population in India at the minute, which is why these countries would then be put on the red list so that there's no active recruitment for healthcare. So coming into the details of why it's important to consider this red list when you are going to be applying for your health and care worker visa, or if you are looking to come into the UK as a healthcare professional. So firstly, let's talk about which are the countries within the red list right now. So there have been an addition of three new South Asian countries into this list. One of them is Pakistan, the second is Bangladesh, and the last is Afghanistan. So these countries have now recently been put on the WHO's red list countries. So this list typically gets updated every 3 years, and in the last list there were about 49 countries, but in the current list, which was released in 2023 by the WHO, 6 new countries were added, like I've described before, of which we are going to be discussing the impact of these 3 countries because they are the South Asian countries where obviously many of us are working as healthcare professionals in the UK. Now, what has happened essentially is, as a result of this list being issued, The Guardian, which is one of the sort of reputed agencies in the UK, has issued another report that we are going to be discussing in this video. So, based on the Guardian's recommendations, obviously the UK government has also gone in and has updated or amended its reports. So, as you can see right here on your screen, the Code of Practice for International Recruitment of Health and Social Care Personnel in England has been amended or updated on the 23rd of March. Now, what you need to understand is that the UK government or the UK Home Office essentially has identified that it has been recruiting several healthcare professionals from these red list countries. Now, because of this list by the WHO, it is now deciding to amend this sort of document just so that it can have more healthier recruitment from countries. So, what's actually mentioned in this report from the UK government is that there is going to be no active recruitment of health and social care personnel from countries on the red list. So, the red list that was drawn by the WHO's report in 2023, no active recruitment will be undertaken from the countries on the red list either by the UK health or social care employing organizations, the recruitment organizations, the agencies, collaborations, contracting bodies, and any international agency that is subcontracted to do so with the organization in the UK. So, obviously, this is going to impact not only people from Pakistan but also from Bangladesh and Afghanistan who are going to be trying to come to the UK as a healthcare professional. Now, that being said, let's just think about what if the UK has a direct link with the government of another country to help professionals from those countries migrate into the UK as a healthcare professional. For example, one of India's neighboring countries, known as Nepal, obviously has this sort of direct tie up between the UK government and the Nepal government. Now, Nepal, if you do not know already, is on the amber list of the WHO. So it's not as bad as the red list, but it is on the amber list. But obviously, in this country, because the governments have a direct connect, they will be ensuring that the healthcare professionals from Nepal will be allowed to be recruited into the UK. Now, this has been a pre-existing sort of contract between these two countries, and so it is very valid and is unaffected by it right now because obviously Nepal is not on the red list of countries issued by the WHO. But please be mindful that if it is a contractual sort of document between the two existing governments, then it will not be impacted. But countries like Pakistan, Bangladesh, and Afghanistan, which do not have this, are going to be the most impacted because they've now come on the red list. Now, one of the other questions that you might have had, and obviously if you've read this sort of bit that I was sharing with you on the screen right now, is Nikita, what if there is no active recruitment? Because active recruitment is essentially when an agency or when an organization has like a drive where it's asking people to apply, or through an agency that is promoting, professionals from Pakistan or Bangladesh to essentially apply for jobs in the UK. What if we independently apply to these jobs? Would that situation change then? So, like I've always recommended to a lot of you, if you haven't already done this, please go and check out this video on how you can apply to jobs in the NHS so that you can get a sponsored job in the UK. But if you are independently applying through yourself, the details about this are not so clear at this stage from all of the rules and regulations that I've shared on the video so far. So if you are applying independently, because it is not a sort of active recruitment where the company or the organization or the agency is trying to actively recruit you, it's more of a personal initiative from your end to land a job in the UK, it might not be falling under the red list bit right now. But again, like I said, a lot of information around this is still not available, and we just need to wait and see what essentially that would mean for most of us. Now, coming around to another sort of very important question, which I'm sure is affecting many of y'all who are watching this video, saying, Nikita, if I already have a health and care worker visa, is this news going to impact me? I mean, for example, I'm from India. Is this news going to impact me in any way? And the answer is no. This sort of news is only going to impact people who are now actively trying to come into the UK. But if you've already been granted a visa, if you've already been practicing in the UK and would like to renew or extend your visa, then this news is not going to impact you. So that's a good news for all of you guys out there who have landed your health and care worker visas or who are already practicing in the UK on your health and care worker visas. Now, just in terms of a final sort of question for this video, which is, I know in my previous video, which was a while ago, I've said that they might be looking at shutting the health and care worker visa, so closing it down permanently, because like you are aware, the sort of health and care worker visa came in right in the middle of COVID, where they were looking at increasing the number of healthcare professionals in the UK so as to help the UK government generally tackle the COVID situation. And it was a pilot project, so it was a sort of temporary way to evaluate if this is going to help. And they were looking at plans of possibly shutting this visa down in a year's time, which was February 2023. But as of today, no more updates have been issued upon this topic. So I would just want to reassure all of you out there watching this video that none of it has been updated. And as soon as there are any updates about if this visa is going to shut or if this visa is going to continue, I will issue that out on my channel. But as of today, nothing has been said. So please feel safe to apply for the health and care worker visa as soon as you are eligible for it. And if you do not know what is the health and care worker visa, I will still urge you to watch this video just so that you get some more information about it. But that's it for today's video, guys, and I hope you found that informative. If you did, do not forget to like, share, and subscribe, and leave your questions down in the comment section below. Take care. See ya.